Hi guys, welcome to my channel Health Education with Deborah. And if you're new, please do well to subscribe, like and share this video. And if you have subscribed already, thank you so much. You're the real MVP. Thank you so much for your support. I do not take it for granted. Today I'm talking about ulcers. It can be called stomach ulcer, peptic ulcer, or gastric ulcer. There's also duodenal ulcer. This one happens in the first part of the intestine, which is duodenum. Now, what are ulcers? They are open sores that occur in the lining of your digestive tract. Simply, you know the way you have wound, a fresh open wound. Yes, that's wound or sore in the lining of the digestive tract, inside your intestine, inside your stomach. That is what ulcer is. So what are the symptoms and signs of ulcer? One of the major symptoms is pain, sharp pain in the epigastric region. You can see the image I put up. Also, when you eat, you experience indigestion. You feel so full, and you also experience pain after eating. Also, you can experience blood in your stool when you go to the toilet, and after you're done pooing, you can see droplets of bloody stool. Another thing is you can experience nausea and vomiting. You can experience acid reflux, experience heartburn and dizziness or general body weakness. So these are the signs and symptoms of ulcers. What are the causes of ulcers? Number one is the H. pylori infection. Yes, this is a bacteria, Helicobacter pylori bacteria, that likes to live in the stomach when it gets access into your body, and then it inhabits that place. In some persons, it does not cause any harm, but usually when it multiplies, it begins to cause harm to that area and erode the lining of the stomach or the intestine. And also be aware that your stomach already produces certain acids, stomach acids like the pepsin, the trypsin, and enzymes that act on food to break food down. Now, these same acids and enzymes, too, when they are open source, will now also be impacting on the wound you have already. That is where the pain you experience comes from. Okay, let's move on to the second one. The second one is the use of non-steroidal anti-inflammatory drugs. All this big English, all I'm saying is those medications that we usually take for inflammation, for headache, for fever, for pain, any small pain you feel, you carry drug, put inside your stomach without even eating. Give me para, give me ibuprofen, give me this one, give me that one. You take it, swallow it, and empty stomach. So you don't even use water. Yes. These things, the reaction of these drugs can cause you ulcer. That is one thing I want you to know. And bear in mind that the H. pylori infection, what are the ways that you can contact it? One of the ways is, I was actually shocked when I found out that it can be transmitted from person to person by saliva. In other words, kissing is one way to even transmit H. pylori bacteria to somebody. And also, fecal contamination of food and water, poor hygiene, crowded areas, people living together in hostel areas, lodge areas, and, interacting, using things together. Even in families too, it can be spread across because they use utensils and other things together. So once the bacteria is around, the spreading it is quite easy. And this bacteria has something called flagella that helps it to easily attach to the walls of the intestine and cause its harm. Another thing I want to point out is that H. pylori, Helicobacter pylori bacteria that causes ulcer is one bacteria that also causes cancer. So don't just say it's not just common ulcer. Ulcer can predispose you to gastric cancer. And there's another condition too that can make someone have ulcer. It's called the Zollinger-Ellison syndrome. I already told you that your body has stomach acids and enzymes that are used to break down food. So some persons, their body produces excess of these enzymes and acids, and they just have, ulcer naturally. And also, physiological stress can cause one to have ulcers, especially if you're recovering from an illness or an injury, you have been on medications for long, especially people with terminal illnesses too, diabetes, kidney, HIV, you consume a lot of medication, so it can also predispose you to having ulcers. So there are things that make your symptoms worse or trigger your pain and reactions. One of them is smoking, drinking alcohol, and when you eat spicy, peppery, acidic foods and hot foods, it can trigger your pain and other reactions. It is not every sharp pain you feel in your stomach in certain regions that you attribute to ulcers. That's why it's important to get tested and be able to the doctor can be able to narrow down your diagnosis to what exactly is wrong with you and what is causing the pain. Okay, what is the diagnosis of ulcer? One of the diagnoses is an X-ray procedure called barium contrast. In this case, you're going to swallow a color contrast solution that coats your digestive lining and enables the doctor to identify if there are any sores, wounds, or ulcers in your stomach or intestine. And another thing is the endoscopy. Lighted tube is passed through, and then with a camera that tries to capture your internal organs, and it will be easier to identify if there are open sores or wounds in there. Another way is the urea breath test. You're made to take in an oral capsule, a solution of urea, and after some time, you're made to breathe into a bag, and the level of CO2 that was released into the bag is being measured. And for that urea breath test, you're supposed to avoid antibiotics for about 4 weeks, and you're supposed to fast for about 6 hours. Then the very common ones are the H. pylori blood test, whereby we use an antigen to identify if there are antibodies that your body has produced against the Helicobacter bacteria. Fifth one is the H. pylori stool antigen test. In this case, you bring your stool to the lab. We're able to test if probably some of the bacteria agents have been passed into your stool, and then we test you and find out. Then the sixth one is the fecal occult blood test. Aside causing you ulcers, there can also be perforation of your stomach walls and intestinal walls, like open holes, and also bleeding. So certain maybe droplets of blood can find its way into your stool. The fecal occult blood test is used to now identify if there are hidden blood agents or elements in your stool that can be pointing to something. All right, how do you avoid having ulcers? One of the ways is to eat on time. When you feel hungry, please eat. Because the stomach acids and enzymes that are already there, waiting for food to be broken down, when they don't see anything, they start acting on your stomach lining and your digestive lining. Do you understand? Another way is avoid excessive use of NSAIDs, those drugs that are for pain, fever, headaches, inflammation. Take drugs with caution and take drugs with water too. Another thing is avoid alcohol, avoid, contaminated foods. Try to wash your hands properly before you eat. Don't just eat anywhere. Know the hygiene of where you're eating. It's not even normal to walk into and eat, because poor hygiene also contributes to getting this Helicobacter pylori infection. Also, don't ignore your symptoms. If you have certain kind of symptoms consistently, the sharply, visit the hospital, get tested, and if you're giving treatment, take the treatments religiously to be able to clear the bacteria, and you'll be fine. Also, if you have it already, your management should be avoid spicy, peppery, hot foods. Don't take these things a lot. And foods that contain a lot of acids, like orange, it's has citric acid too. And take more of foods like yogurt, fruits, vegetables, honey, carrots, just to enable yourselves to be able to heal. There are certain treatments for it. I'm not a doctor. I'm not going to tell you how or what treatments to take. So thank you for watching. Thank you for your time. Thank you for listening to me. I will be bringing you some other information that is very, very important on another subject some other time. Please stay tuned. If you're yet to subscribe, please do so. And if you have questions, comments, things or something you want me to talk about specifically or explain better, please do well to leave it in the comment section. I will attend to it. I will, make a video on it if possible and clarify you on it properly. And if you have any symptom, please don't forget to visit the hospital, get tested, and get treated. Also, it's not just common. It can predispose you to gastric cancer, and that is something that is way worse. So thank you so much, and see you some other time.